What is a narcissistic personality disorder? A narcissistic personality disorder, NPD, is a mental disorder that occurs when an individual has a grandiose sense of self-importance and a lack of empathy for others. Individuals with narcissistic personality disorder have a profound lack of self-confidence and believe that they are special. They often display arrogant and haughty behavior, along with an unshakable belief in their own superiority. People with this condition may have an inflated sense of their own abilities and be very demanding. They may use sarcasm as a tool to belittle others, and also expect special treatment or favorable treatment from others. People with NPD often have a difficult time forming healthy relationships and can be very controlling and domineering. They are also often uncooperative and arrogant, which can make it difficult for them to find work or maintain relationships. Now that we introduced narcissistic personality disorder, let's discuss in detail 17 of narcissistic personality disorder traits. 1. A sense of entitlement. People with NPD feel that they are entitled to special treatment and privileges regardless of the circumstances. 2. Entitlement to admiration. People with NPD feel that they are the only ones who understand what's really going on, and they need constant affirmation from others in order to feel good about themselves. 3. A lack of empathy. People with NPD often do not care about or understand the feelings of other people, which can lead to conflicts or problems in relationships. 4. A lack of remorse and shame. People with NPD are often completely unconcerned about their own behavior, which can lead to problems in relationships. 5. A sense of superiority. People with NPD feel that they are better than most other people, and this feeling is difficult for them to control. 6. A lack of guilt. If a person with NPD feels that others are being hurt by their behavior, they may feel that they do not need to apologize or compensate the other person for their actions. 7. A need for power. People with NPD feel that they are entitled to reward and punishment, and may expect you to give in to their demands. 8. A fear of intimacy. If you are close to someone with NPD, they may be very uncomfortable with your closeness. 9. A lack of realistic goals. People with NPD tend to have exaggerated ideas about their own ability and skills, and may expect others to agree with this. 10. A tendency to be manipulative. People with NPD may use their charm and charisma to manipulate others without realizing it. 11. A tendency to be arrogant. People with NPD may have a strong need for admiration from others, but this does not mean that they are good at being humble. 12. A tendency to be exploitive. People with NPD may use their charm and charisma to exploit others without realizing it. 13. A tendency to be self-pity. People with NPD may have a strong need for attention from others, but this does not mean that they care about the people around them. 14. A tendency to be self-destructive. People with this condition often display behaviors that lead to their own destruction, including excessive spending, mistreatment of others, and risky behavior. 15. A tendency to be suspicious. People with NPD often display intense suspicion of others, believing that they are always under attack and must vigilantly protect themselves from humiliation or injury. 16. A tendency to be jealous. Individuals with NPD may feel extreme envy or jealousy over anything that seems to reflect well on other people, such as success, attractiveness, or social status. And finally, trait 17. A tendency to be untrustworthy. People with NPD often exhibit untrustworthy behavior, as they believe that they are superior to others and do not care about the feelings of others. But what causes narcissistic personality disorder? The cause of NPD is unknown, but it may be caused by a combination of genetic and environmental factors. Risk factors may include childhood abuse, neglect, or criticism, having a parent or other adult figure who is narcissistic, experiencing traumatic events in life, being raised in a family with strong cultural values that glorify self-promotion and achievement. But how is narcissistic personality disorder treated? Individuals with NPD often have difficulty regulating their emotions and are often hypersensitive to any criticism or rejection. Treatment typically involves both psychotherapy and medication. Psychotherapy can help individuals learn how to manage their emotions and relationships more effectively. Medication can help relieve symptoms such as depression and anxiety. There is no single cure for NPD, but treatment can help improve the quality of life for those who suffer from the disorder. In conclusion, narcissistic personality disorder is a serious mental illness that should not be taken lightly. It can cause a lot of damage to both the individual with the disorder and to those around them. If you think that you or someone you know may be suffering from a narcissistic personality disorder, please seek help from a professional. If you enjoyed the video, please like, subscribe, and share for more videos like this.